A little boy, Harvey, born in the Lismore Base Hospital in northern New South Wales. His family from Casino, Chantel and Glenn are his parents. They can't go visit him in hospital in Brisbane. Now, of course, Queensland Health has saved this little boy's life, but his parents can't visit him. Let's have a listen to the parents yesterday.
FaceTime just not the same because I can't even lay a finger on him and just say that I love him. He's just hooked up to tubes, he's sleeping, and he doesn't get to hear my heartbeat and feel the comfort through that.
Chantel Northfield there talking about wanting to get to see her little boy. She saw him taken off in a helicopter to Queensland hours after his birth. Let's go to Queensland now and catch up with the Shadow Health Minister, Rosslyn Bates. Thanks for joining us, Ros. We haven't had it confirmed, but we believed that the Queensland government at the moment are looking to facilitate a visit. They've relented after a few days of lobbying, and they might let that mother and perhaps father as well get in to see the baby boy, Harvey.
Well, good evening, Chris. It's nice to be on your show, but unfortunately, you know, as a mother, this story absolutely breaks my heart, and I'm not surprised that thousands of people have signed a petition to support these parents. And I can't imagine the hurt and the fear that they'd be feeling tonight. You know, you can have strong borders, but you still have to show some compassion. And I really hope that Anastasia Palaszczuk can find a way for these parents to get to see their little baby. As a nurse, I know how important it is to be with your child after their birth. Skin on skin is really important. And I feel for these parents, not only as a mum, but as a nurse as well.
Well, it just seems to me to be a classic example of how we've lost the plot in this country when it comes to the coronavirus epidemic, the pandemic. I mean, sure, you've got to have rules in place if they must close borders, which I've got suspicions about anyway, but surely there's got to be exceptions. If parents need to be with a sick baby, they can wear masks, they can wash their hands, they can keep their distance from other people. I mean, it's not rocket science, is it? We all know how to manage and minimise the chances of infections.
Absolutely we do. And, you know, certainly there has to be exemptions for medical emergencies like these. You know, our borders, need to be protected, but we need to show compassion. And, you know, it's really important. And I feel so sorry for, you know, especially if this is their first baby. I mean, little baby Harvey is miles away from his parents. All they want to do is touch and hold him and see that the care that he's being given, and obviously it's appropriate care, and Queensland Health are doing the best that they possibly can. But we need to show that, you know, we do care about people. We've seen fake diplomats get through here into Queensland. We've seen celebrities be given exemptions. I mean, for goodness sake. This is, something that is so very important for this young couple, and I feel for them. And Anastasia Palaszczuk, if she hasn't already done something about it, she really needs to do something.
This should have taken 1 minute. This should have taken one phone call to the minister to have been fixed on Friday, surely.
Absolutely. And look, Chris, I'm from the Gold Coast, so, you know, we know that the border is fluid across there through the northern New South Wales. We've got nurses and doctors travelling across the border at the moment. And, of course, there's the fear that there might be a hard border closure for the bubble itself. When I moved to Queensland, worked at Tweed Heads Hospital. So I know that on any given day, 50% of the patients in Tweed Heads Hospital are actually Southern Gold Coasters. Almost 60% of the staff who work across the border, either at Murwillumbah or at Tweed, for instance, they are all from the Southern Gold Coast. And we need to, obviously protect our borders, but make allowances for those people who work on both sides of the borders and those people who have loved ones on both sides of that border.
Spot on. Thanks for joining us, Ros.
Thanks very much, Chris.